Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for our fall series for coverage year 2024. Today's webinar is Tying It All Together. I'm Heyison the Health Projects Assistant at the Center on Budget and Policy Priorities, and I'll be moderating today's webinar. Beyond the Basics is a project of the Center. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare sisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes. And while we hope you will learn a lot, we are not able to offer continuing education for credit for our webinars at this time. Next slide. Automated captions have been enabled for this webinar. To view them, you can either click on the More option with 3 dots at the bottom of your screen, or you will see 2 C's icon that can turn on closed captioning also at the bottom of your screen. All participants will be muted and in listen-only mode, but if you would like to ask a question, you can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. Throughout the presentation, we will be monitoring the chat and we will pause for Q&A during the presentation. Though we will not be able to answer every question asked, we will have a record of all of your questions and we will use them as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. A quick reminder, you won't be able to click on your screen to go to any of the links shared in the deck, but I will put a link to the slide deck in the chat where you can find all active links to everything shared today. And after today's webinar, we'll email a recording of the presentation along with the link to the slides and other resources. Next slide. Here you can see the schedule of webinars in our fall series. This is our second to last webinar in the series, and this is our last webinar in English. On Thursday, we will close out the series with a webinar in Spanish that focuses on enrollment issues most relevant for people who are immigrants and people who live in mixed immigration status households. We are still celebrating 10 years of marketplace coverage as a part of our series this year. And to celebrate, at each webinar, we'll be spotlighting veteran assisters from around the country. I'll turn it over to Jenny Sullivan for our anniversary segment. Next slide.
Great. Thank you so much, Heyison, and welcome everyone to our last webinar for our fall series in English. Although for those of you who speak Spanish and your colleagues, we hope that you'll join us on Thursday as well for our real final webinar for this fall series. But for our penultimate assister spotlight, we are featuring Lisa Hart. Lisa is a certified application counselor and insurance counselor at Pratt Regional Medical Center in Pratt, Kansas. She's been doing this work for a while. She's coming up on her 9-year anniversary this Friday, timely. Lisa's philosophy when it comes to providing enrollment assistance is the individual doesn't care what I know until I know that they care, until they know that I care. She understands each person is unique and must be treated with kindness and respect. And as an example of this, a client came in for an appointment to see if she qualified for marketplace insurance, but Lisa picked up on one of the client's other concerns about her mother's health and lack of insurance, as well as her mother's need for other health and social supports. Lisa listened and asked pertinent questions and first offered contact information on community support organizations to help the client's mother and actually help the client realize that her mother may also qualify for marketplace coverage. Once she was able to address those pressing needs, then she was able to transition to help the client successfully enroll in marketplace coverage. So Lisa's advice is being an assister is more than educating and helping fill out an application. It's meeting and accepting an individual where they are in their life journey and addressing non-health insurance issues so they can focus on the purpose of their meeting with you. And we know so many of you do this every day when you meet with clients. You do a lot more than just help them determine their household size and their income and pick a plan. So Lisa, thank you so much for the example you set and for your service in the community. And thanks to all of you for joining us in this celebration of the faces and stories of your colleagues around the country. It's been really special to hear about the work that you all do and really to celebrate you as we enter this 10th year of marketplace coverage. So with that, I am going to turn it back over to Ayesette to tee us up for today's presentation.
Next slide. Thanks, Jenny. Now on to the main event. Today's webinar will provide a summary of the key concepts covered in this year's webinar series, as demonstrated through a series of scenarios. Our presenters are Claire Heyison, Senior Policy Analyst on the CBP Health Team, and Jenny Sullivan, the Director of Health Coverage Access. I'll turn it over to Claire now to get us started.
Thanks. Next slide. So today we're going to start off with an example from the Sandoval family. Next slide. We'll be focusing in this example on automatic redetermination and renewal, changing plans, and updating income. So here we have the Sandoval family, which includes Monica, Elena, and their daughter, Isabel. Monica and Elena are married and file taxes jointly. Neither of them have offers of coverage at work, and all members of the family are currently enrolled in a bronze plan, and they have a projected income of $54,000, or 234% of the federal poverty level in 2023. Next slide. So the Sandoval family gets a notice from healthcare.gov about open enrollment, recommending that they update their household information. But, you know, life gets in the way and they don't have a chance to do so. Next slide. In early December, they receive an eligibility determination notice from healthcare.gov. They've been automatically re-enrolled into a silver plan with cost sharing reductions, or CSR, under the same insurance company that they had last year. So this is a new policy that's going to be taking effect this open enrollment in states that use healthcare.gov, and it will only happen if some certain conditions are met. So in order to be re-enrolled from a bronze plan into a silver plan, the enrollee has to be eligible for cost sharing reductions. There has to be a health plan with the same provider network as the plan that the enrollee was in last year. And the plan has to have a lower or equivalent premium than the plan that they had last year, after taking into account the advanced premium tax credit that the enrollee receives. Next slide. So the Sandoval family doesn't take any action on healthcare.gov after receiving this notice, and they're automatically re-enrolled in the new silver plan that was assigned to them. They receive an enrollment confirmation from their insurance carrier and their first premium bill. And because they were passively re-enrolled into a new plan, they didn't go back to healthcare.gov and update their information. This first premium bill is going to be a regular premium and not a binder payment. So the family still has to pay this premium in order to get coverage, but if they miss it, their plan will go into a grace period and not be terminated immediately. And again, this is because they were already enrolled in a plan in 2023 and then were passively re-enrolled into a new plan for 2024. Next slide. So if the Sandoval family didn't go back into their application and update their information, how is their premium tax credit determined, since their income information maybe isn't current? Well, the healthcare.gov updates income for people in this situation by maintaining the federal poverty level of their 2023 projected income. So as you can see in the example on the right here, in 2023, the family's projected income was 234% of the federal poverty level. Their, since they didn't re-enter their income information, healthcare.gov, the marketplace keeps that percentage the same and then updates their income based on how the poverty guidelines have changed year over year. So the information that's used includes the updated federal poverty guidelines. It also includes the 2024 benchmark plan premium information. And the income and the family's most recent income information adjusted to 2024. So for this family, it would be their 2023 projected income. If the client doesn't have a 2023 projected income, the marketplace would then use 2022 tax data. And if neither of those is available, they would use projected 2022 income. Next slide. So Isabel, Monica and Elena's daughter, has epilepsy. And on January 10th, Monica realizes that Isabel's neurologist isn't covered by their new plan. The plan doesn't work for them anymore, and they'd like to be able to choose a different one. So they can still do this if they choose a new plan by January 15th, which is when open enrollment ends. And assuming that they had already paid their January premium, they'll have coverage in their old plan for the rest of the month of January. And their new plan will come into effect on February 1st at the earliest. And again, since they have actively chosen a new plan, the first premium that they pay for this new plan will be a binder payment. Next slide. In April, Elena shifts from full-time salary to part-time hourly work, and they return to healthcare.gov to update their income. Next slide. Elena's prior income estimate will be displayed in the application, and they can update it. First, the application is going to ask about monthly income in order to determine whether Elena is likely to be eligible for Medicaid. Next slide. Healthcare.gov then takes that monthly income information and multiplies it by 12. They assume that her wage applies for the full year, but in her situation, that's not the case. So she'll use the tools provided to update her income estimate. And as you can see, there are kind of two tools that she can use to do this, the income calculator or the monthly estimator. Next slide. So let's take a look at the income calculator. Under this tool, a person can include different types of income or different types of expenses and be able to prorate that for different periods of the year. Next slide. Using the monthly estimator, you'll be asked to input an estimate of monthly income, again, with kind of one month's income in each box. Next slide. So with lower monthly household income, Isabel now appears to be eligible for CHIP. And her application will be transferred to the state's Medicaid and CHIP agency. If Isabel is found to be eligible for CHIP, her parents should cancel her marketplace coverage. And if they don't, her dual enrollment in CHIP and the marketplace could be detected through periodic data matching or PDM that's conducted by the marketplace. If this happens, the family will have 30 days after they're notified of the problem to change their plan or prove that Isabel is not, in fact, dually enrolled. If they don't respond, Isabel will stay on her parents' marketplace plan, but she will not be eligible for financial help. And because she has insurance, she will also no longer be eligible for CHIP. Monica and Elena will be responsible for the full cost of her share of the premium. Next slide. So taking a closer look at the results of the eligibility determination, the notice states that Monica and Elena are eligible for APTC and CSR, same as they were last year or previously before their income changed. Isabel is likely eligible for CHIP, and they will not need to submit documents to verify their income. And this is because in 2024, an income data matching issue, or DMI, will only be triggered if a person's income decreases by more than $12,000 and is also more than 50% lower than the previous year. Elena's income did drop by over $12,000, but she doesn't meet that second condition of having her income decrease by more than 50%. Next slide. In our next scenario, we'll be looking at the Wang and Lee family. Next slide. We'll be focusing on navigating the loss of Medicaid coverage, determining who is in the household, determining household income, and understanding eligibility for the advanced premium tax credit and Medicaid/CHIP. So Sharon Wang lives with her children, Lily and Russell Lee. Sharon shares custody of her children with Joe Lee. Joe lives separately and claims Lily and Russell as dependents. In 2024, Joe predicts that his income will be $84,000, and Sharon predicts that hers will be $42,000. Everyone lives in Missouri, which is a Medicaid expansion state. Next slide. So a bit of history on this family. In 2021, Sharon lost her job, and she and her children enrolled in Medicaid. All of their Medicaid mail goes to Sharon's house. In 2022, Sharon got a new job and her income increased, but because Medicaid redeterminations were paused, Sharon and her children kept their Medicaid coverage. In April 2023, Missouri began redetermining eligibility for Medicaid and CHIP. And a few months later, the next time Sharon goes to the doctor, she realizes that she and her children no longer have insurance. They've lost Medicaid because they did not submit their renewal paperwork on time. So Sharon goes to healthcare.gov to see what coverage is available for her and her family. Next slide. The application starts by asking a lot of questions about the family's relationships and living situation. Next slide. They also ask about tax filing. So although Joe is not a member of Sharon's tax household, he should still be added to the application because he claims the kids as dependents. And you can see in the example at right, the application asks who will claim Russell on their 2023 federal tax return and gives you the option to add a person who will claim Russell if that person is not already listed on the application. Next slide. To claim a premium tax credit, an enrollee needs to file a tax return. For Medicaid, tax filing is not necessary. Joe usually claims the kids. So let's take a look at the qualifications for claiming a dependent and make sure that Lily and Russell fit those descriptions. So dependent children can include the tax filer's child, stepchild, adopted child, foster child, brother, sister, niece, nephew, or grandchild. They meet that condition. They are U.S. citizens or they are U.S. citizens. They're both under 19 and neither of them has income. But recall that Lily and Russell live with their mother. So what's going on here? Next. So there is an exception to this requirement if there is a legal agreement, like a custody agreement, which states that the non-custodial parent will claim the kids. Basically, Sharon has waived her right to claim the kids as dependents. So this is a situation that can come up and is good to be aware of. Next slide. The application next asks whether anyone in the family recently lost Medicaid or CHIP. And Sharon selects that she and the kids have lost coverage. Her income and household size have not changed since they lost coverage. Next slide. Next, the application asks whether anyone in the family was found not eligible for Medicaid or CHIP. And this is different from losing Medicaid or CHIP. As many of you probably know, you can lose Medicaid or CHIP for what is called procedural reasons. So that could be because they weren't able to turn in paperwork or never received that paperwork. They never applied for Medicaid or CHIP, or they've been found not eligible for Medicaid or CHIP by the marketplace instead of the state Medicaid or CHIP agency. So under the Learn More About Being Found Not Eligible for Medicaid or CHIP link there is a sidebar that kind of guides you as to whether or under what conditions you should select whether a person was determined ineligible for Medicaid. And Sharon, in her situation, should select none of these people. Next slide. So when a state ends a person's Medicaid or CHIP, the state must send a termination letter that includes the reason that the person was disenrolled from the program. And so if you're not sure what is going on in a person's situation, a good first step would be to ask if they received a termination letter and see if they can read through it or bring it to you to determine what the reason for losing Medicaid coverage was. If a client doesn't have their termination letter, or if the reason for termination is unclear, you can use their household size and income to determine whether it's likely that they were actually ineligible for Medicaid. It's very important to answer this question accurately. If a person states that they were found not eligible, the application will not automatically check to see if they are eligible for Medicaid or CHIP, even if their income and household size suggests that they might be. However, there is a way to check for Medicaid eligibility after the application is submitted. If healthcare.gov finds that one or more members of the household is ineligible for Medicaid, you can request that their information be sent to the state for a full Medicaid determination. Next slide. So the next step in the application is reporting income, and everyone on the application is asked to provide information about their income, again, including Joe. Next slide. Joe has an offer of self-only employer-sponsored insurance, and Sharon's job does not offer any insurance benefits. So when the application asks about job-based health coverage, Sharon selects that yes, Joe has an offer and she does not. The application then asks for some information about the offer of employer coverage. So first, whether it meets the minimum value standard. The minimum value standard means that a plan has an actuarial value of greater than 60%. Most employer offers of coverage do meet the minimum value standard, but if you're not sure, it will be on the plan's summary of benefits and coverage, which your client can request from their employer or benefits professional. Next slide. The next question is about whether the employer-sponsored insurance offer is affordable. So in 2024, the employer-sponsored insurance is considered affordable if the employee's contribution for the lowest cost plan is less than 8.39% of household income. If the employer coverage is affordable, if it's below that threshold, the employee cannot qualify for APTC. Joe's premium coverage to his employer coverage is 3.1% of his household income, which is below the 8.39% threshold. He is not eligible for APTC. Next slide. So Sharon submits the application, and these are the results she gets back. She is eligible to enroll in a marketplace plan with APTC, and she's able to do this because she qualifies for the Medicaid unwinding SEP, or special enrollment period. In healthcare.gov states, people who lose Medicaid or CHIP between March 31st, 2023 and July 31st, 2024 can enroll at any point during this period. So even if it's been more than 60 days since Sharon lost her Medicaid, if it's within this period, she can still enroll in marketplace coverage. After July 31st, that should say 2024, people losing Medicaid or CHIP in healthcare.gov states will have 60 days before and 90 days after their coverage ends to enroll in a marketplace plan. And that 90 days is different from previous years when it's been 60 days after coverage ends. That is a new rule that will take effect in 2024. Getting back to the eligibility determination or eligibility overview, the kids are determined or assessed that they may be eligible for for CHIP. And Joe can enroll in self-only employer-sponsored coverage or purchase a marketplace plan, but he is not eligible for APTC or CSR. And both Sharon and Joe need to send documents to confirm their eligibility. Next slide. So Joe's income is 320% of, or at 320% of the federal poverty level. So why are the kids eligible for CHIP? As a reminder, the application assesses eligibility for Medicaid before it assesses eligibility for the marketplace. And although the children are Joe's tax dependents, they fall under one of the exceptions to the Medicaid household and income rules. They are claimed as a tax dependent by a non-custodial parent. So under Medicaid rules, Russell and Lily are considered to be part of Sharon's household. So their household income is $42,000, which is under the threshold for CHIP eligibility in their state. Next slide. And so here is a bit of a reminder of how Medicaid and CHIP eligibility works and who's considered a tax filer, tax dependent, or non-filer, non-dependent. As you can see in the middle column, there is an exception for individuals under age 19 who are claimed as tax dependents by non-custodial parents. And for these individuals, their household is made up of themselves, plus any siblings under 19, their parents, and children living with the individual. Next slide. So now we will take a brief break for questions.
Yes, thank you, Claire. We have a good amount of questions. To start off, this question is in reference to the first family with the first scenario. And it's, what if Isabel's health provider does not accept CHIP or is not in the network?
So in that case, I mean, Isabel would still be eligible for CHIP. She could enroll in marketplace coverage, but wouldn't be able to receive the premium tax credit or cost sharing reductions.
Thank you. And this next question is in reference to the second scenario regarding the determining households. Does it have to be a legal agreement or just an agreement between parents?
I believe there does have to be some kind of legal agreement. However, I mean, if the parent decides on their own to waive their right to claim the children as a dependent, then yes, that would be sufficient.
Yeah. And just to note that we are getting a lot of questions on divorced parents and dependent coverage, and we will look into creating a separate FAQ on that, and we work on creating more resources on that. So continuing with a couple more questions. What if someone is re-enrolled from a bronze plan to a silver plan and doesn't like the new plan? Can they switch?
So the same rules would apply in this situation as for other passive re-enrollment situations. The person can switch plans before open enrollment ends on January 15th. And after that, they'd either need to qualify for a special enrollment period or wait until the next open enrollment period. If their 2022 bronze plan was discontinued, they'd be eligible for an SEP for loss of other qualifying coverage, and would be able to enroll in a marketplace plan either 60 days before or 60 days after their plan is discontinued.
Awesome. And one last question for this Q&A. If Joe had an offer of family coverage, could the kids get marketplace coverage through the family glitch fix?
No. So healthcare.gov assesses eligibility for Medicaid first. And again, under Medicaid rules, the kids are part of Sharon's household, and her monthly income makes them eligible for CHIP. If the kids lived with their dad and had an offer of family, and he had an offer of family coverage, then yes, they could be eligible for marketplace coverage if the offer of family coverage was not affordable. So more than 8.39% of household income in 2024.
Awesome. And just, I know I said that was the last question, but just one last question before we move on. Is MEC greater than or 60%? Sorry, let me reread that. Is MEC greater than or 60% or more coverage?
Sorry, I'm not sure if I understand. Is the question, is MEC greater than 60% actuary, or is coverage that has 60% actuarial value or greater considered MEC?
Yeah, I believe that was the meaning of the question. Yes, that is correct. The person clarified, it is correct.
Okay, so for what we're talking about here, we're talking about kind of the minimum adequacy standard. Minimum essential coverage is kind of a separate concept.
Okay. Thank you, Claire. We will have another Q&A break towards the end of the presentation. And next, I'll turn it to Jenny to get us started with the second half.
Great. Thanks so much, Heyison. And great job with that first half, Claire. Now we're going to walk through a couple more scenarios to tease out some more concepts. And this next scenario is about the Bailey family. So the Bailey family is Mike and Lauren. They're married, and their children are Jadrian, who's 8 years old, and Samara, who is 6. Their projected household income for this coming year, although we can assume it's roughly the same in 2023 as it will be in 2024, is about 205% of the federal poverty level. So earlier this year, Mike lost his job and enrolled in COBRA continuation coverage. The family was enrolled in coverage with him through his job, but when he lost coverage, they got a special enrollment period. And at that time, Mike opted to enroll in COBRA. He had certain providers that he wanted to continue seeing through his employer coverage plan. But his spouse, Lauren, decided to enroll in marketplace coverage at the time. Jadrian and Samara have been enrolled in Medicaid their whole life, although their coverage was recently terminated. So we're going to walk through some concepts related to COBRA and marketplace interactions, ESI and marketplace interactions, although we've already done some of that this afternoon, marketplace coverage renewal, Medicaid unwinding, and the APTC repayment safe harbor. But it's going to be easier than it sounds, pretty painless. So first, let's walk through person by person. First, we have Mike. As I mentioned, he was laid off earlier this year, but decided to enroll in COBRA at that time. Fortunately, he's found a new job that's going to be starting in December, and he does have an offer of employer coverage. But they want to get all their ducks in a row and figure out what their options are. So what are Mike's options? Well, he could keep COBRA. There's nothing that says he has to drop COBRA when he has a new employer offer, but his employer contributions will run out next summer. He knows that's coming. And he also knows that he can't drop COBRA mid-year and pick up marketplace coverage after that special enrollment period when he initially lost employer coverage. But if he keeps COBRA, it's pretty expensive, as COBRA often is, at $600 a month. His next option would be to enroll in that new offer of job-based coverage that's coming up in December. Although it meets all the qualifications for a qualified offer of employer coverage, but it's pretty expensive as well at $525 a month, which comes out at over 10% of their household income. Of course, his third option would be potentially to enroll in marketplace coverage, but is he going to qualify for financial help? Because that really is going to be what helps make the decision. Well, we know he'd be eligible based on his income because it's over 100% of poverty. We know he's married and filing jointly, so he has that eligible filing status, but is he eligible for other minimum essential coverage? Well, we know he has that employer offer, but is it affordable? It's not affordable. It's more than 10% of his income, which exceeds that offer, that 8.39% threshold. So it's not considered affordable, which means Mike could certainly apply for marketplace coverage and qualify for APTC and CSR. Let's move on now to Lauren. Now she, as I mentioned, declined the COBRA offer earlier this year and enrolled in a marketplace plan. And she heard that her enrollment would automatically continue for next year, so she didn't really think she needed to do anything. But they're having a conversation with an assister because they've got a lot of things going on with their coverage right now. She's currently enrolled in a bronze level plan, but based on their income, we know that she's likely, or she does qualify for a silver level plan with cost sharing reductions. So what are her options? Well, let's keep in mind Lauren had that 60-day loss of minimum essential coverage special enrollment period when Mike lost his job and employer-sponsored coverage earlier this year. And she decided to enroll in the marketplace, and she wasn't planning to come back during open enrollment. But now that they're going to be back into their marketplace account anyway, to update Mike's situation and get him enrolled in a marketplace plan, they'll already be in a position to actively re-enroll for her as well. So her options would be potentially spousal coverage through Mike's employer coverage if he were to pick that up, but not surprisingly, because his coverage was quite expensive, the family coverage offered by that employer is also quite expensive at $900 a month, easily exceeding that 8.39% threshold. It would be 18% of their income, so it would not be considered affordable, which means that she could continue to get marketplace coverage with financial assistance. They'll both qualify for APTC and CSR, but she may want to switch to a silver plan to lower her out-of-pocket costs. And for folks familiar with healthcare.gov, you know that the marketplace will do some nudges throughout the process online to encourage people to consider a silver level plan to take full advantage of those lower out-of-pocket costs available with CSR plans. Now, because they're going in and they're going to be actively re-enrolling for 2024, the automated bronze to silver architecture that Claire talked about in the earlier example won't apply because they'll already be in there making an active choice. But the marketplace is still going to encourage them to seriously consider a plan that will offer them the greatest amount of financial assistance. So finally, let's move on to the children, Jadrian and Samara. They've been enrolled in Medicaid since they were born, but their coverage was recently terminated, and Mike and Lauren don't understand why. So what options do they have? Well, the things to remember are, number one, that Medicaid eligibility is always determined based on monthly income. So if you were looking at a scenario like this, you want to make sure you're asking what the monthly income was throughout the year to confirm that there wasn't some sort of spike that led to them becoming no longer eligible. In this case, their monthly income was never higher than 205% in 2023, so we don't think that that should have been a cause for them losing eligibility for cause. This means that even if you don't have all the notices in front of you, or even if Mike and Lauren never received those notices in the first place, the odds are that Jadrian and Samara have been procedurally terminated because of Medicaid unwinding, meaning they missed the window to return paperwork to confirm their continued eligibility for Medicaid, and the state ended their coverage. But the good news is that they're likely still eligible. So what are their options? Well, it's important to act quickly if possible, because the Baileys have 90 days from the date Jadrian and Samara lost coverage to send in the renewal form and get their Medicaid coverage reinstated. If they've moved out of that 90-day window and they've been without Medicaid for longer than that, then they can go back and reapply to Medicaid immediately to request a new determination of eligibility. So where we've landed is for 2024, Mike and Lauren will enroll in a marketplace plan, hopefully with both APTC and CSR. They choose a silver plan. And they'll log into Lauren's account to do that and report a life change to add Mike to marketplace coverage. They should also work with their state Medicaid agency separately to get Jadrian and Samara's coverage reinstated. This is the best way to get somebody's coverage reinstated, somebody's Medicaid coverage. Working only through healthcare.gov and the marketplace is not the most efficient way to get somebody back into Medicaid. Now, when they're updating their information, and you'll recognize this question from one of Claire's earlier scenarios as well, they're going to be asked this question: were any of these people found not eligible for Medicaid? And we'll say they're in Oklahoma, so it was Sooner Care, in the last 3 months. And they're definitely going to want to select none of these people. Again, if you clicked on the help text there to learn more about being found not eligible for Medicaid, you would see that if your Medicaid coverage was terminated because you failed to return paperwork, that's not the same as being found ineligible. And so you want to select none of these people, which then cues the marketplace to make a full determination or a full assessment, depending on the state, of Medicaid eligibility and refer that application on to the Medicaid agency. Now, in this case, because we're looking at potentially getting coverage reinstated, again, important to work directly with the Medicaid agency if at all possible. But when they're updating their marketplace application, there is also going to be a ping from the marketplace, if you will, queuing the state Medicaid agency up to the fact that Jadrian and Samara are likely eligible, and then getting the state to do a full consideration of their case as well. So a question here: what if Jadrian and Samara, in this interim when it was unclear what was going on, maybe the family applied for marketplace coverage for them, answered that question differently in a way such that the marketplace did not consider them for Medicaid eligibility? They may have gotten a determination that they were eligible for premium tax credits in 2023. This could be very confusing for folks, and it does happen sometimes, depending again on how people answer these questions about Medicaid eligibility and whether people's coverage has been canceled or terminated. Excuse me, I'm going to get a quick drink of water. And there's a concern here that if people's coverage in Medicaid is reinstated, but they had been getting premium tax credits, are they going to owe all of that back? That's a scary proposition for folks. And the answer is no. That's because once a person has been determined eligible for premium tax credits, they're treated as ineligible for Medicaid or CHIP for purposes of PTC eligibility for the remainder of the year. It doesn't mean that they're not eligible for Medicaid or CHIP for purposes of Medicaid or CHIP eligibility. They still are. And as soon as they get re-enrolled in Medicaid or CHIP, it's important to end APTC so that they're not getting assistance that they don't need and are no longer eligible for. But eventually, the marketplace may detect their dual enrollment if they don't actively cancel marketplace coverage. The marketplace may detect that dual enrollment through periodic data matching. And if people don't respond to that within 30 days, could terminate APTC and cost sharing reductions, but not the marketplace plan. Only the financial help would be canceled in that case, which would leave the family on the hook for full cost premiums for a marketplace plan until they actively cancel that as well. All of this is to say, this is really not a situation that should happen often, but because we're in some rough seas right now, it may happen. And it's important to reassure people that they won't have a repayment obligation, but they will need to go back and cancel that coverage as soon as they realize that Medicaid is where they belong. Okay, let's move on to our fourth and last scenario this afternoon, the Schmidt family. And before I get into this, we're going to be talking about Medicare coverage here, and I just want to underscore one rule of thumb. Today, we're going to be talking about people who already have marketplace coverage and are about to become Medicare eligible, but people who are enrolled in Medicare generally cannot transition from Medicare to marketplace coverage. There's a federal prohibition on the sale and issuance of duplicate coverage to Medicare beneficiaries, and it's illegal to knowingly sell or issue a marketplace or other individual market plan to a Medicare enrollee. There are some exceptions, but these don't apply to most people. They don't apply to the Schmidts, who we're going to talk more about now. So we have Gary and Bonnie. They're both 64. They're enrolled in marketplace coverage with financial assistance and a combined household income of $35,000. But they know that change is coming. Their Medicare is right around the corner when they turn 65. So they want some help figuring out these coverage transitions. So again, first we need to look at what makes them eligible for the marketplace. We know that they are both US citizens. They neither are incarcerated, and they're both residents in a marketplace service area. We'll say Florida, judging by that beach behind them. And we know for APTC and CSR eligibility, they have to have an income of at least 100% of FPL, which they do. They have to have an eligible tax filing status, married filing jointly, so they do. And they have to be ineligible for other minimum essential coverage, and this is where their pending transitions to Medicare come in. So, is Medicare minimum essential coverage? Well, the quick and easy answer is yes, but reading the fine print, it's important to understand that premium-free Medicare Part A and Part B, which is what most people have, is considered minimum essential coverage, as is Medicare Part C, otherwise known as Medicare Advantage. Medicare Part B only, or Medicare that somebody pays a premium for, is not considered minimum essential coverage. So let's look individually at Gary and Bonnie. Gary's turning 65 in June, and he'll be eligible for premium-free Medicare Part A. He qualifies for automatic enrollment, which means he's going to get his Medicare card in the mail in March, 3 months before his birthday, and his coverage will start the month he turns 65, so on June 1st. As of June 1st, he'll no longer be eligible for financial help through the marketplace. Bonnie, on the other hand, while she's also eligible for premium-free Medicare Part A, she does not qualify for automatic enrollment in Part A. She has to actively enroll. So her Medicare initial enrollment period begins 3 months before her birthday. Her birthday's in September, so 3 months before is June, and it ends 3 months after her birthday in December. If she enrolls in Medicare between June and August, her Medicare will start September 1st. If she enrolls during September through December, then her Medicare will start the month after she signs up. If she misses her initial enrollment window, she'll have to wait for the Medicare general enrollment period. The next one would be between January and March of 2025, and she may face late enrollment penalties, assuming she doesn't qualify for a Medicare special enrollment period. Just like Gary, she'll no longer be eligible for APTC or CSR as of the first day of the month that her Medicare coverage begins, or if she misses that initial enrollment period and doesn't enroll at all, she still becomes ineligible for financial help through the marketplace on the first day of the 4th month after she turns 65, or January 1st, 2025. So she decides to enroll in Medicare with coverage starting September 1st, as soon as she can get it. So we know to fill out this last row, Gary is ineligible for other minimum essential coverage only through May 31st. Bonnie is only ineligible for other minimum essential coverage through August 31st. So let's map out that coverage transition for the year. Between January and the end of May, they're both enrolled in Marketplace with APTC and CSR. They'll need to call the Marketplace call center May 31st, to terminate Gary's marketplace coverage effective June 1st, and to change the household contact to Bonnie so that Bonnie's marketplace coverage doesn't end at that time. Gary will transition to Medicare, and Bonnie will stay enrolled in marketplace coverage with APTC and CSR for the next 3 months. At the end of August, we'll tell the marketplace to terminate Bonnie's marketplace enrollment effective September 1st. And because at this point she'll be the only person on the account, she can actually plan that change in advance on the marketplace website. She'll transition to Medicare starting September 1st. Now, what if Gary or Bonnie didn't end their marketplace coverage when Medicare began? Well, they would eventually get a periodic data matching notice that flags this. But when they initially applied for their marketplace coverage, they were asked whether they wanted the marketplace to end their coverage if they were found to have other coverage like Medicare. So if they selected yes to this question, the marketplace will end their coverage when this happens. On the other hand, if they don't give the marketplace permission to end their coverage, they'll have to take action to cancel their marketplace enrollment. Otherwise, their APTC and CSR will eventually be terminated, but their overall marketplace coverage would not. And here's an example of that periodic data matching notice. It will tell people all of their options and what they need to do. Within 30 days, they need to either end their financial help, terminate the plan altogether, which is what most people would want to do, provide written documentation that they're not enrolled in both programs if that weren't actually the case, or change the response to the automatically end coverage question that I showed on the previous slide. But what about people who miss the initial enrollment period to enroll in Medicare? Well, because Bonnie was already enrolled in a marketplace plan when she became Medicare eligible, she could technically keep her marketplace coverage, but she would lose financial assistance as of the first day of the 4th month after she turned 65, and she would face penalties if she later enrolled in Medicare. So as you can see, this example just looks at a Florida zip code and shows that without financial help, you're looking at around $1,000 plus a month for marketplace coverage compared to less than $200 a month for Medicare. And that doesn't take into account that Bonnie might qualify for Medicare savings programs that would lower the cost of her Medicare premiums. And what about people who don't qualify for premium-free Medicare? So let's change the scenario a bit and say that Bonnie had a household income of $35,000, so the same as before, but she was single and didn't qualify for premium-free Medicare. In this case, she could keep her marketplace coverage with financial assistance, but if she later enrolled in Medicare, she would lose her financial help and face late enrollment penalties in Medicare. So these situations can get technical and specific really quickly. And so if you find somebody who is about to be eligible for Medicare with a premium, then it's best to get help from somebody who's steeped in Medicare eligibility issues to help map out all of the potential options and costs so that the consumer can make an informed decision. You can see here, without taking into account Medicare savings programs, staying in the marketplace would be much more affordable for this person, this hypothetical person. But if they were eligible for Medicare savings programs, the calculus might look quite different. So important to always talk to an expert if you find yourself with somebody in this situation. And we, of course, recommend working with state health insurance assistance programs. Every state has a SHIP program. That's redundant, just like the CHIP program, but a SHIP that provides free, unbiased help with Medicare-related issues. Here's the contact information. You probably know these folks well. I hope that you have great partnerships with them. I think there are some folks who are even serve both as SHIPs and CACs or other kinds of assisters, but they're a great resource if you need help with technical issues related to Medicare. So with that, I'm going to turn it back over to Heyison to see if we have more questions.
Thanks, Jenny. Yes, we do have a good amount of questions. And just to note, if we are not able to get to everyone's questions today, we will try our best reaching out through the Beyond the Basics email to get your questions answered. So first question is, isn't the ending of a COBRA policy, the end of the 18 months of coverage, considered a special enrollment event?
That's correct. If COBRA is ending and or the subsidies that somebody is getting, if they're having subsidized COBRA from their employer, if that ends, then that is its own trigger for a special enrollment period for marketplace coverage. In the scenario we laid out here, the example was just that they were sort of happy with it, but it was more expensive than they would have preferred. And so that's why they chose during open enrollment to make the switch to the marketplace. But yes, when COBRA ends, it's a special enrollment period, but you can't just drop COBRA outside of the open enrollment period unless you're already in another special enrollment period, if that makes sense.
This next question is referencing scenario 3. What do Jadrian and Samara do for their coverage during the time it takes for Medicaid to reconsider their eligibility? It could be 45 to 90 days.
It's true. This is the unfortunate situation that many families are grappling with right now as we wrestle our way through the Medicaid unwinding process. And it really depends on the state. There's not a requirement in every state for coverage retroactivity to be connected to the 90-day reconsideration period. But in the states that allow retroactive coverage at application, a lot of states will cover up to 90 days of retroactive coverage for medical bills during the time 90 days prior to Medicaid application. If a state has retroactive coverage, then that would also apply in this case. So they would be paying out of pocket for coverage that they received while between when their Medicaid was terminated and when they get it reinstated, but then Medicaid could pick up the cost of those bills after they get back in. However, some states have waivers and they don't grant retroactive coverage. And in this case, those families would be out of luck. There would be a gap in coverage for people in that situation.
Great, thank you. And we have another question that asks, when would the marketplace end coverage if the box is checked?
Let's see.
I think we may need a little bit more context, and we can
Yeah,
get
no, I'm like,
back to the question through our Beyond the Basics email if we can't get to it right now.
Okay, we will get back to you, Angie. Thanks for that question.
So another question we do have is, could Bonnie keep marketplace coverage with APTC and CSR through the end of 2024?
That's a great question. If you'll recall, the way that we set up this scenario, her initial enrollment period actually goes through the end of December. So in this case, she's happy with her marketplace coverage and she's not in a hurry to transition to Medicare. There's not any reason that she has to transition September 1st. Again, she might want to look at what the cost differential is, but if she wants to stick with with marketplace through the end of December, she could absolutely do that and keep her financial help. And then she would need to transfer, make the election for Medicare coverage in December. Her Medicare coverage would start in January and she would cancel her marketplace coverage effective as of December 31st, so that there was no overlap between those two forms of coverage. But it's absolutely an option if that happens to be when someone's birthday is.
Awesome, thank you. And one last question we have here is, I often see Part A of Medicare backdated. How does this affect APTC eligibility and repayment?
So if somebody is receiving Medicare benefits, if they're actively enrolled and able to use Medicare coverage, then as of the date that starts, they are no longer eligible for financial help. And so they would have to repay any APTC received after the date that their Medicare coverage began. If, again, they are eligible for Medicare coverage and it is the first day of the 4th month after they've become eligible, then their APTC eligibility also ends, even if their Medicare hasn't started. So there's sort of a branching of decisions there. But for most people, as soon as you're Medicare eligible, you're no longer eligible for marketplace coverage. Or, excuse me, you're no longer eligible for financial assistance through the marketplace.
Thank you, Jenny. That's all the questions for this portion of the Q&A. But again, we will try to reach out to those that we did not get to. Next slide. Here you can see the contact information for Claire and Jennifer, and of course, just general inquiries for Beyond the Basics. Next slide. As a reminder, we will be distributing the materials from today's session via email, and we will post everything to the Beyond the Basics website. Our next webinar will be helping people who speak Spanish obtain health coverage, tips and best practices on Thursday, October 26th at 2 p.m. Eastern Time. You can register for this on the Beyond the Basics website under upcoming webinars. And with that, we will bring this webinar to a close. Thank you all for joining us today.